Welcome to the Counselor's Soapbox video channel, our series on drug counseling, part 6. In this episode, we'll talk about individual counseling sessions and group counseling. A definition: counseling individual sessions. Counseling is the utilization of special skills to assist individuals, families, or groups in achieving objectives through exploration of a problem and its ramifications, examination of attitudes and feelings, consideration of alternative solutions, and decision-making. Tab 21 defines some core counseling elements as individual counseling, group counseling, and counseling families, couples, and significant others. These are all skills that a drug and alcohol counselor is expected to have or to develop. In this part of the series, we're going to talk very briefly about individual counseling. This is an overview. We will talk more about the counselor's toolbox and the skills they use throughout the rest of this series. Tab 21 defines counseling as a collaborative process that facilitates the client's progress toward mutually determined treatment goals and objectives. Counselors are expected to know and to utilize best practices. What are best practices? They're programs and procedures that have been listed with the government that are being tested to see that they do what they say they do. The National Registry of Evidence-Based Programs and Practices can be found online at the SAMHSA website. Drug and alcohol counselors need to be familiar with culturally appropriate counseling methods. This is sometimes called multicultural counseling. There are three basic principles involved: knowing yourself, being aware of your own views, prejudices, and biases, knowing your client, and knowing counseling skills. There are many other factors to keep in mind in addition to culture. Consider, when working with a client, their socio-cultural background, economic status, stressors, family dynamics, social roles, and the particular subcultures that your client may be a member of. It's important to consider the differences in the viewpoint between the counselor and the client. What the counselor often sees when they look at their clients are lives that are out of control, unmanageability, and that the clients are scared, confused, angry, depressed, anxious, or even downright numb. While the counselor may see a very difficult situation, what the client is expecting is that the counselor will fix them. They often want help, but are not yet prepared to work that hard. Your client may have a fear of failure, may be angry or hostile, and the barriers to their recovery may seem insurmountable. A brief word about counseling theories. In graduate level work, people spend a lot of time on studying various theories. But the basics are: a theory explains what is wrong, what has caused this problem, and therefore what needs to be done to fix the problem. Theoretical orientation implies techniques, but most clinicians or counselors borrow techniques from a wide variety of theoretical orientations. Here is a short list of commonly applied theories. Client-centered counseling involves empathy and unconditional positive regard. It's largely about listening to the client. Cognitive behavioral therapy, or CBT, is based on the idea that whatever the person is thinking will create feelings, and the feelings will create actions. This also works in reverse. As people take action, their feelings will alter, and that will cause a change in their thinking. The REBT model is similar to cognitive behavioral therapy and comes from Albert Ellis. It has a model, ABCDE model, often used in anger management, which shows how between the events that happen to us and the effects they have on us, we often have beliefs about those events. Some counselors use learning theory. What is the lesson the client still needs to learn? There's also a group of therapists or counselors who consider themselves to do narrative therapy. The basis of this is what story the client tells themselves. I'm stupid, I'm helpless, I'm a survivor. Whatever they're telling themselves about their problem creates an outcome. Helping them to create a new story may help change their outcome. One effective technique in counseling is solution-focused brief. This is based on the idea that we don't necessarily need to go back and work on everything that's ever happened in the person's life in order to change current situations. What is the major problem that needs to be solved? Drugs and alcohol. And in solution-focused brief, the work is aimed at that particular issue. Other systems or theories include group work, which is different from individual counseling, working with managed care, which shapes what's being done in counseling because of the funding source, and systems theory, which we talk about in terms of how the drug and alcohol using persons' behavior has affected their families, but how the family system and the family of origin they came from has affected them. Counselors don't get to use a lot of physical tools. There's no saws or wrenches needed. The main tool that the counselor will use is themselves. And they have to work on their own issues, but they also have to develop a set of skills that are necessary to become an effective counselor. They do this through education, but also through experience and through being supervised on the job site. There are a great many techniques that can be used to explore the problem. Each of these techniques could be the subject of an entire training and require some experience and practice to become efficient at using. But a brief run through them. Timeline is creating a history of when your client began to use drugs, which drugs they used, and how their addiction developed. The Johari window is a technique for looking at the things that the client keeps secret from others, and also the things that others notice about them that they don't know themselves. Autobiography, writing out your life story, can be very helpful to clients to see how their life has progressed and how they've learned certain things or decided that their life is a certain way. Journaling, writing every day simply about what's happening and their challenges, is another technique. Cost assessment involves how much money and time was spent getting, using drugs, and recovering. Values clarification can be very helpful. It's important for people to know what their life goals are. Some ways of getting at that might be to write an obituary. What would they want people to remember about them when they are gone? Or what would they want to be on their tombstone? Other advanced techniques could include family sculpturing or genograms, looking at relationships with others. In working with communication issues with others, there's sometimes the technique of an empty chair. You can't necessarily talk to a person, but if that person were sitting in that chair, what would you like to say to them? Another technique is if you feel you have unfinished business with someone from your past, you can write a letter to them. Say the person is deceased, you write that letter. These letters are not meant to be sent, but they're meant to help the person clarify their thoughts. keeping a thought record of when various thoughts intrude on them, thoughts of using or drinking or whatever. Also, a technique which is really a part of most programs is behavioral experiments. In group and in meetings and so on, the client tries on new behaviors to see how those will affect their lives. Some additional counselor tools that you might develop. ABCs, the two parts method, in which you ask the client, one part of you feels this way, but another part of you feels this way. Handouts can be used. Discussions of cravings, when do they come, what causes them. There's an advanced technique called guided imagery, in which the counselor tells a story and the client makes note of their reaction to it. It's common to write a goodbye letter to your drug of choice. A collage or other artwork can be useful for clients who have difficulty putting things into words. They may draw the picture or cut pictures from a magazine and paste them to make a picture of what they're trying to express. Scaling is a useful technique. On a scale of 1 to 10, how strong is, how important is a particular characteristic or feeling. Various forms of autobiographical writing, writing about a particular person from your life, writing about a particular incident. Some counselors develop, some programs have worksheets which the clients can fill out about a particular topic. And teaching clients deep breathing and relaxation techniques can also be very useful for helping them manage their stress. Feelings work can be an important part of drug and alcohol counseling. Programs often have separate feelings groups to discuss feelings. Feelings, both positive and negative, can be triggers for relapse. Many patients, clients, seem to suffer from a condition called alexithymia, which is, I don't have a word to describe how I'm feeling. Feelings can come in a great many different shades. They're not simply red or blue or purple, but might be, for example, in the color palette, lilac or fuchsia or wisteria. So learning to identify and label feelings can be very helpful. There are 3 steps that we use to make feelings our friends. One is to recognize when you're feeling something. Often that's easiest to do by where in the body are you feeling this. And then once you realize I'm feeling something, neck muscles have tightened or some other physical sensation is taking place, what is that feeling? Learning to name them, label them, can be very helpful. Then, once you know you're feeling it and you know what it is you're feeling, what do you want to do with this feeling? I think it's common to dismiss intuition or feelings as not useful in this modern age, but in fact, many of our nerve cells are spread throughout our body. When we say that someone makes us sick to our stomach, there are actually nerve cells wrapped around your stomach and intestine that are contracting. So it's important to learn to trust some of this intuition, which is based on past life experiences. This can help people avoid dangerous or risky situations. What skills will the beginning counselor need to develop? This is a very brief list, and each of these skills require both knowledge and practice. The first one is relationship building. Without developing rapport and a good relationship with the client, nothing of value happens. Often a great skill for counselors to work on is listening. The client may need to tell their story and feel heard before they can do anything else. Facilitating client work is important. So we help clients to do self-exploration, help them learn to disclose to self and to others. Clients need to learn to do problem solving, and often they have unfinished business which they need to deal with. We educate the client. Of course, part of that is the process of informed consent, what's going to happen in therapy. But a lot of other education happens throughout the counseling experience. Counselors need to learn the stages of change model and how to match their intervention to where the client is in their process of change. Constantly, the counselor will be monitoring for safety, for relapse potential, and for any possibility of a crisis. Learning to apply techniques that are helpful to individualize treatment, and counselors need to be able to evaluate the effectiveness of the treatment approach that they're taking. They need to learn the skills to plan for recovery after treatment and to be able to teach the family and others about substance use disorder. Counselors also need to learn paperwork and documentation for everything else that they're doing. Group counseling is an important skill and is distinct from individual counseling skills. Much of the work in substance abuse, both in treatment and in self-help groups, is conducted in group setting, which makes sense as often the major problem in the person with the drug problem's life is that their relationships with others have been disrupted. Some of the skills the counselor will need to develop are traffic control. There are always people who want to talk a lot and people who don't want to say much, and so we need to moderate who talks next so they're not all talking at once. You want to prevent one person from dominating, taking over, and running the group and excluding others. But you also need to be pulling in people who are not saying much, making sure they have every opportunity to speak. The counselor is constantly scanning the group to see how people are being affected by and how they are reacting to what's taking place in the group. Group counseling is a very specialized skill and very important for the counselor to develop. In a future video, we'll look at this skill of group counseling more specifically. What's ahead for the Counselor Soapbox video channel? More in our Learning About Drug Counseling series, more drug education videos, and a series on mental health and wellness. If you've enjoyed this video, please click the like button directly below. For more information, please visit the counselorsoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.